facial rejuvenation and facial contouring, we have to think of this as a continuum, as one big paradigm. And it comes down to, very simply, just the shape of the face. And the shape of the face is dependent on a number of factors. The skin is one part, then there is the muscular activity, then there is musculoskeletal, or the bony volume and the muscular volume, and finally is the skin texture. Okay, so we have to kind of break down the face into all of these parameters and these factors to be able to best understand what it is we're going to be doing and what are the various options that are available in order to be able to achieve the best results. Okay, so let me go ahead and write down these things and then we can talk about them. Okay, so the first thing that everyone kind of thinks about is skin laxity. Skin laxity, or how loose the skin is. Right here in this area, it could be underneath the eyes, it could be the upper lid, it could be the forehead skin. We don't often think of it that way, but it's the forehead skin laxity that causes the low brows, and by decreasing that, we do a brow lift. And just as a side note, a facelift also is a whole umbrella term. It's not just one thing. I mean, a facelift could be applied to the eyelids, in which case we call it a blepharoplasty. A facelift could be applied to the forehead. It would be called a brow lift. So all these little specific areas of lifting, all within the paradigm of facelifting, are treatments that can be customized for the individual look and the aesthetics that we're going for, all based on the underlying anatomy and fully understanding the effects of aging and the effects of environmental factors and the genetic things on the face that can make us kind of be away from the look that we're wanting. Okay, so let's talk about this. Again, I mentioned skin laxity. Then let's talk about muscular effects. Okay, then we can talk about volume changes. All right, and then texture. I don't know if you've seen that meme with a bunch of doctors that are demonstrating and you can't really read their handwriting. I'm trying to stay away from that. Okay, so skin laxity, there's ways of dealing with that. Okay, we can decrease skin laxity or looseness and hide it by little camouflage techniques. One is increasing volume. So you can see that all of these have an interchangeable relationship together as well. So if I increase the volume in an area, just by the nature of lifting it, the lower part, the dependent part, gets lifted. We often talk about a raisin back to a grape analogy. That is for the wrinkled part, but you can also imagine the divoted areas in the raisin get lifted by increasing the volume in another part of that. Okay, so a very practical example of this is the nasolabial folds, for example. This loose skin can get lifted if we fill these areas. Okay, we know that with aging, the maxilla rotates under and there is some bony resorption. And with these changes together, this skin that is no longer, that was on your cheeks is no longer well supported. The fat distribution changes and that skin is now low. That has an effect on your nasolabial folds, on your midface, the volume of your lateral cheeks, and your lower lids, because all that it takes is 1 centimeter of pull and my look changes. Okay, so repositioning that and understanding the changes that take effect is what's important. So if I just lift just the skin, I've done nothing to restore the correct volume. I've done nothing to restore the correct position of the deeper underlying structures. That's very key to understand. Skin laxity, if we're just dealing with the skin, I can affect volume, like I mentioned. The next thing is I can pull the skin and bunch it up and hide it somewhere. Okay, I can distribute. Let's think about a wrinkled skin. If I distribute it, if I pull it taut, you'll have an excess. That excess is the excess that will be cutting out, excising in a true surgical facelift. But if I distribute this excess over areas that are not visible in your hairline or in other areas, then I've effectively been able to achieve a little bit of straightening, therefore decreasing laxity by way of just pulling and hiding. And that is how threads work. We use threads to pull and hide, camouflage the excess. The other way is to internally truly make the skin itself contract. And you've heard me in other videos talk about a steak on the grill analogy. That's how we can apply heat technology, radio frequency technology to the skin and make the skin internally inherently shrink. Okay, so we'll call that face tight. Remember that this can be applied to any skin anywhere. It can be the arm excess skin, it can be the area over the knee, it can be the nasolabial folds underneath the eyes or the lower neck, and lower face and neck. Or we can just cut that excess skin out with the surgery, facelift and BLEF and all the other lifts. So this is the skin laxity category. Okay, I'll change colors because we don't have flowers, so we'll make this nicer. Then there's the muscular effect. Okay, so think about the effect of your frontalis muscle on the position of your brows, on the position and on the wrinkles of the forehead. So if we have, for example, activity of the frontalis, which mine I have Botox, so you don't see much of it, that will create those wrinkles. If I place Botox, wrinkles are gone, but now the brows cannot be lifted. So my brows come here. If I habitually raise my brows to be able to speak with you, to keep my eyes open because my brows are heavy, then I also need to get rid of that depressor effect to allow for a lifting of the brow. So you can essentially do reshaping using Botox or Jeuveau, any of these botulinum toxins, to selectively address the muscular action. But the muscular volume is also important. So if we think about a very boxy jawline, for example, the effect that we have is now very masculinizing. Maybe that's not what we want. Then we can decrease, therefore, the size of the masseter muscles in the corners by applying Botox, and that'll feminize the face, soften the face, and create that more of a V-shaped look as opposed to a boxy look. Conversely, though, in someone who wants a chiseled jawline, a very angulated jawline, we add to that. We would add fillers along the jawline to improve that. So you have to truly select, and this is my thinking when I'm looking at this. I go through each category of patient's anatomy based on their aesthetic looks and select the treatment that best matches them. And also based on what you want. Because, I mean, if you don't want a surgery, then I can't offer you that. Then we go to a face tight. Okay, so we'll talk about that. Botox, muscular effect. We can do implants. Okay. Well, I guess that's not so much muscular effect. So I'll just cross that out. Botox is the main thing on muscular effect. Sometimes I can do neurolysis, get rid of the muscle, the nerve impulse to a muscle. Over time, the muscle would shrink or atrophy. This is true in case of the nerve that goes to the masseter, and it is also true in case of a number of selective neurolysis that we do in cases of reconstruction for patients with facial synkinesis. Let's talk about volume changes. Okay, so volume underneath the eye. This area needs to be assessed correctly. Volume of the cheeks. Just think about cheek fillers alone is enough to show you how just a few centimeters and a little bit of volume can go such a long way, because filling the medial cheeks kind of gives that cute or girl next door look, whereas filling the lateral cheeks creates more of an editorial model look. And we're, instead of placing the fillers here, we're just going a little bit lateral and giving that lift, kind of a V-shaped look. So correct volume placement. How do we affect volume changes? We have fillers, we have implants that we can place permanently, and we have implants for the chin, we have implants for the angle of the jaw, we have implants for the tear trough, mid-face, temples, all of these areas. We have implants for that are silicone based and very safe to place. We also can perform fat transfer, which is liposuctioning fat from you in a different area and then processing that and re-injecting it into the area that we want to affect that volume change. Then there is texture. That's the superficial skin texture, the way your skin looks, and also how tight the skin on the outside is, how closed the pores are, how the discoloration works and patchiness and all of these other things that are superficial skin, and they don't get affected or worked on when I perform, for example, a facelift. So then we have, of course, very basic skin regimen, very important. Treatment-wise, we have skin pen microneedling that can work. We have Morpheus 8, that is a combination of microneedling and radiofrequency to also affect tightness. And we have then chemical peels, dermabrasion, and microdermabrasion, and all of these things. When I talk about a facelift, this is what I'm talking about. When I talk about facial contouring, all of this is what I'm talking about. Often we focus too much on skin laxity, but in reality, it's important to understand that there is some volume changes, there's some descent of structures, repositioning is important, restoring volume is important, skin pull is important, and we have many surgical and non-surgical options available for that, and all of these can be they're customizable and can be customized, because this is not an all or none thing. We can do a little bit of something or a lot of something. So all of it really depends on the look you're going for, whether you want surgery or not, and kind of the lifestyle and the downtime you can afford, and all of these factors. It's important to come in, sit down, we have a one-on-one consultation. We can really figure this out together. I can get into your head, understand the look you want, and look at your anatomy, then we can make a plan together.